Some of the words and language we use have negative meaning for people who are at high risk for HIV or who have HIV. Our words should be supportive and not stigmatizing. Let's explore some of the things we say as well as better choices. Some people simply say AIDS when referring to the HIV virus. That's not right. HIV and AIDS are not synonymous. We should be saying HIV when referring to the virus and HIV and AIDS when referring to both. Some people use phrases like to catch AIDS or HIV or to pass on HIV, but AIDS can't be caught or transmitted, and HIV can be transmitted, but it's not hereditary. So we should use phrases like to be diagnosed with HIV or to acquire or transmit HIV. We use the phrase unprotected sex, which often refers to sex without a condom. But there are other ways to engage in safe sex to prevent HIV, so we need to be specific. How about sex without a condom or medicines to prevent and treat HIV? We use the phrase body fluids, but body fluids covers all the fluids in the body, and only some of the fluids are involved in HIV transmission, so it's important to be specific. What are we talking about? Blood, amniotic fluid, semen, breast milk? The list goes on and on. Some people talk about battling HIV and AIDS or the war against HIV and AIDS, but doesn't that sound militaristic? And it sounds like people have to be fought or eliminated if they have HIV. Instead, we should say response to HIV and AIDS. We talk about high risk groups or groups with high risk behavior as if people who are in those groups are automatically HIV positive and people who aren't are safe. No. How about just high risk behavior or key populations at higher risk? And what is absolutely wrong is the use of words like victims, sufferers, contaminated, and sick to refer to people with HIV. It makes them sound powerless. How about people or person with HIV? Calling people AIDS patients and HIV patients is just demoralizing and offensive. You're only a patient in a medical setting. Stop calling people patients at work. Call them persons with AIDS or a person with HIV. Calling people positives and HIVers and AIDS or HIV carriers is just insensitive. People are not HIV or AIDS. They are people who live with HIV or they progress to having an AIDS diagnosis. Just say people or person with HIV or AIDS or an HIV positive person. So, can we agree to monitor our language and be more sensitive? Because our words do matter. This public service announcement was brought to you by the Central Jersey Alumni Chapter of Delta Sigma Theta Sorority, Incorporated.